Yeah, so my time is effectively split half and half between the emergency department and then the trauma units. So when I'm in the ED, I can see a little bit of everything, and it really just kind of depends on who shows up and what the doctors think we can help with. I would say the most common type of patients we see down there are like acute orthopedic type injuries, oftentimes just a back pain that it gets so bad they don't know where else to go, so they show up to the ER, and we can treat them there and kind of triage, help them figure out what comes next. We also do see patients down there that are similar to I'd see on we call it the floor, the standard hospital floors, where we just need to figure out if they're safe enough to get home, whether they're older, they've had a fall, or they've been in a car accident or anything like that. And then we do see a lot of those vestibular patients down there where we're screening, okay, you're dizzy, we want to rule out a stroke, and then if it's not a stroke, we want to figure out what comes next, and even we can start the treatment that day. I would say those are the most common groups in the ED, but sprinkled in a little bit of everything that kind of keeps you on your toes down there. And then when I'm in the shock trauma unit, we have an ICU and then a step-down floor, and I cover both. So on a normal day, I'm in both units. And the ICU, we're seeing with patients who have whatever it may be, a car crash, mountain biking accident, or gunshot wound, a really bad fall, where there's usually pretty intense injuries, broken bones, they may be connected to a ventilator, they've usually got all kinds of IVs and lines hooked up to them, and we're starting just really small of trying to get them moving little by little,